Hi, this is Dr. Kevin Smith with Red Apple Wellness and Chiropractic in Bethel Park, Pennsylvania. Thank you very much for checking out this video. Today I'm going to talk to you about arthritis. And arthritis is a condition whereby you have inflammation of the joints in your body. The word itis, anything that ends in the word itis, means inflammation. So if it's inflammation of the joint, that would be arthritis. Inflammation of the liver would be hepatitis. Of the larynx will be laryngitis. So what we're dealing with is inflammation. And inflammation typically occurs naturally and normally after some kind of a tissue injury. And there are four cardinal signs of inflammation. There's redness, swelling, heat, and pain. And those naturally occur when you have tissue destruction or tissue injury. That's part of the healing process. But if you can't shut that down, and if it's constant and ongoing, and it's a chronic inflammation, and specifically a chronic inflammation of the joint, that's arthritis. And that's not natural, and it's definitely not something that you want to have. And there are there's many different types of arthritis problems, but the two most common ones is osteoarthritis and rheumatoid arthritis. And I'll explain the difference. With rheumatoid arthritis, that's actually an autoimmune disease whereby your immune system, your white blood cells in your body, is actually attacking the synovial joints of your body, causing damage to the joints. And you may have seen elderly people that have their hands all disfigured, their joints all twisted up, and their knuckles all swollen. That is rheumatoid arthritis most of the time. That's an autoimmune attack, and it's fairly common. And then there's different variants underneath rheumatoid arthritis, such as psoriatic arthritis, where people will have red, flaky skin in addition to having joint pain. And this pain, that doesn't necessarily have to attack the hands. It can attack the spine, like ankylosing spondylitis. It's another type of an autoimmune attack. Now that is autoimmune disease. That's a very different type of problem and not really something that I treat in my office. The other type of arthritis is osteoarthritis. The word osteo means bone. And osteoarthritis is very commonly referred to as old age arthritis or wear and tear arthritis. So that's the type of arthritis that you see people that have long-standing degeneration in their spine, where the discs start to thin out, and you see that the joints want to start to try to fuse together. And when you look at an X-ray, it looks like they're trying to the end joints are trying to reach out and kind of fuse to each other and bind to each other. It's also caused by recurring traumas. Professional athletes that beat up their body throughout their career typically will develop arthritis in their knees, their hips, their spine, their shoulders. And what you have eventually is that the cartilage, which is the protective covering of the articular surfaces of the joints, starts to wear out, and then you can develop bone-on-bone rubbing. And then you need to get some kind of a joint replacement. Way before you have to have that surgery, though, there are different things that you can do to try to reduce or prevent this problem. One of the best things that you can do is to get adjusted by a chiropractor. Now, how does that help, and why should you do that? Is because chiropractic maintains normal joint motion. So before the joint has a chance to figuratively rust, you have a chance to preserve good joint motion by adjusting the joint and preserving the good fluid, full range of motion. Additionally, chiropractic adjustments preserve your posture and keeps your body limber, so you can do things in full range of motion, from exercising at the gym to swinging a golf club to playing basketball with your kids. So get adjusted, and get adjusted on a regular basis, and you will keep your arthritis issues at bay. Secondly, I recommend that you drink enough water, because your joints need enough water to lubricate them correctly. And the way that you determine that is to weigh yourself, and whatever that number is in pounds, you divide that number in half, and that's how much water you need in ounces. So for example, if somebody weighs 200 pounds, half of that is 100, so you need to drink 100 ounces of water just for general maintenance. Now, if you exercise a lot, you're out sweating quite a bit, and you're losing fluids, you have to drink more. Number 3 is there are certain supplements that you can take that will lubricate your joints. And I call these kind of WD-40 for the joints. And the best one is glucosamine sulfate. I've heard people ask me, well, should I take glucosamine and chondroitin sulfate? And I say, not really, because they kind of cancel each other out. These are both kind of sugar molecules, and if you take both of them together, they will cancel each other out. So just take one, not both, because you're kind of wasting your money. So maintaining your range of motion through chiropractic care, drinking plenty of water, and taking glucosamine sulfate, and good quality glucosamine, not the stuff at the dollar store, but a good quality supplement, it will go a long way. It'll pay dividends. Well, I hope you enjoyed this video, and I hope you learned something. If you have any questions about arthritis, or you'd like to ask me about anything related to chiropractic care or musculoskeletal health, please feel free to contact me through my website at www.redapplewellness.net. Also, please subscribe to my YouTube channel and please tell a friend. Thank you very much for checking out this video.